My name is George Hamilton. I'm going to be doing the health assessment head to toe on my patient today. Um, and I'm now going to start. So, first step, also, I do have my note card with me, it says we are allowed to use. First step is to gather my equipment, which is a pen light and a stethoscope. I'm going to perform hand hygiene, washing my hands, putting on gloves. And then I'm also going to prepare the client. So that includes introducing myself, using two verifiers, and explaining the procedure I'm going to be doing today. Which, my two identifiers, I'm going to be looking at their wrist for their bracelet to see what their name is and date of birth, and then I'm just going to ask them as well what to verify those as well, and then just explain that I'm doing a head to toe assessment today, and my name is George. Nice to meet you. Next step is doing the systematic assessment and is using inspection, auscultation, percussion, and palpation, which I will be doing throughout the assessment. And then I'm going to ensure a safe environment for my patient by making sure that the room is secure, that there's privacy, windows are shut, stuff like that. And then I'm also going to be gathering a general health history and also just like a survey by grabbing vitals and checking their medication history as well. And now I'm going to start my assessment. When I first start, I'm going to start at the head. This is a head to toe assessment. Just going to do a visual inspection of the skin, the head, make sure there's no wounds. And then I'm also going to be checking the pupils for perla. So, going to check both eyes, checking for equal reaction. Just checking for constriction on both eyes. Then I'm going to check the throat for the lymph nodes and then the carotid pulse. And making sure that I only check the carotid with one side instead of both. Don't want to palpate both sides. Also, they would be wearing a gown, so I would have them kind of expose their back, so that way I could check their back when I get to that as well. Going to be checking, doing a visual assessment of the skin on the arms, the neck, making sure there's no wounds or any skin abrasions or any rashes visible. I'm going to go down the arms. We're going to do a brachial pulse check, a radial pulse check for a full minute. You could also do pulse checks by doing 15 seconds and then multiplying your number by 4. You could also do 30 seconds and then multiplying your number by 2. There's another acceptable way. Okay, after you do a full minute for the radial pulse, then you're going to listen to the heart and the lungs. Heart first, and then lungs, because you also have to listen to the back for the lungs. and then listen to the apical pulse for 1 full minute. Okay, so for the apical pulse, I got a reading of 78, which does fall in the normal ranges of 60 to 100 for a young adult. I'm also going to be checking for strength and gait when they're up and walking. So I'm just going to be checking a grasp test. So just go ahead, grab my fingers. All right, and go ahead, push down. All right, so you got strong strength in the hands. I'm also going to be looking for a history of falls or pain in the joints for my patient that could affect their walking abilities or anything with their range of motion. So checking like the fingers, making sure there's full range of motion in the wrist and the arms and the shoulders, and then also checking for capillary refill in the fingers, making sure that I get a refill back in less than 3 seconds. Another thing you can check for is skin turgor for hydration. If the skin goes back quickly within, I believe it's less than 5 seconds, that means that they are hydrated. If not, then they need water because they are dehydrated. So just doing like a little skin pinch and then letting go, and we got good hydration here. And then I'm also going to be listening to the lungs as well. So when I do this, I'm going to ask my client or patient to take deep breaths because I am listening for the sound of the breath, the effort that the lungs are putting in when breathing, and I'm also listening for any crackling or wheezing, because they could have a history of asthma or any sort of other respiratory infection or any other health condition related to the respiratory system. Go ahead, take deep breaths. Okay, and then I'm going to listen to the back of the lungs as well to make sure we got good breathing. Take deep breaths, please. Okay, so we got no crackling or wheezing in the lungs while the client is breathing. We got nice, strong lungs that are breathing effortlessly. After I do an assessment of the head, the arms, the lungs, the heart, I'm going to move on to the GI system, which is the stomach. I would have my patient lay down and then just expose their stomach so that way I can do an inspection of the skin and because I want to inspect first, and then I want to also then percuss, and then palpate. That way, I'm not upsetting the stomach, and then I hear sounds I don't want to hear. So, go over here. If you would like to lay down for me. So I would have them expose their stomach. That way I could inspect. And then I'm just going to listen to the 4 quadrants, starting on the bottom right quadrant. And then move up to the upper right quadrant. And then the upper left. Okay. And what we're listening for is just the sounds of the bowels. Listening for any hyperactivity or hypoactivity, as well as just making sure we actually hear audio coming from the bowels, because if there is no audio, then there's something wrong. After I do that, I would move on to pericare, and I would do that when I'm taking the client to the restroom, doing a full inspection of the genitalia and making sure that the skin is good, and then there's no wounds or any sores. Also, the femoral pulse is right here, and then I'd just be moving down the rest of the legs. I would be looking for any edema that could be in the arms or the legs. Checking the popliteal pulse. Checking the rest of the skin. There's the dorsal pedis pulse and then the posterior tibial. Checking for those, and then checking the toes and the feet for any skin conditions that might be there, as well as checking the capillary flow in the toes as well. That concludes my head to toe assessment. I know this is a 12.5 minute video, which is a little bit longer than the 10 minutes, but that does conclude the health assessment.